In 2026, the Asfari Institute for Civil Society and Citizenship at the American University of Beirut teamed up with the Norwegian Refugee Council and the CAMEALEON Consortium to do a very typical and timely research. This research, 1 year later from the latest Israeli war on Lebanon, looked at the ways in which civil society interacted, reacted. This research had a very specific question. After a year from the Israeli aggression on Lebanon by the end of 2024, we were interested to find out the ways in which civil society responded to the growing humanitarian needs of a population on the move, forcibly on the move. So the research question was asking, what did civil society organizations as first responders, what did they do? How did they identify vulnerable groups? How did they identify their priorities? How did they try to meet their priorities during a very short period of time? And while actually the war and the violence was escalating rapidly. That was our initial research question. This is an action research in nature, meaning that what we wanted out of it is to inform an anticipatory strategy when conflicts occur. Lebanon and the region are known to be the hub of crisis, the hub of multiple conflict, and the hub of perma-crisis, and that is several crises happening at the same time. We wanted to understand the ways in which civil society acted and reacted. We wanted to tease out the lesson learned, and we wanted to have evidence-based information of what best to do and what best not to do in a situation of conflict and forced displacement.
CAMEALEON, also known for the Cash Monitoring, Evaluation, Accountability and Learning Organizational Network, is a strategic research and learning platform established in 2017 by each of NRC, Oxfam and Solidarité International. Now, during its third phase, CAMEALEON has been working to address critical evidence gaps and strengthen social assistance systems for the extremely poor and vulnerable populations in Lebanon. We generate rigorous evidence and translate it into informed policy dialogue, engaging the government of Lebanon, UN agencies, local and international NGOs, as well as civil society actors. The establishment of our partnership with the Asfari Institute at AUB was actually rooted in a shared commitment to policy influence and meaningful social change in Lebanon. Each institution brings complementary strengths, whereby CAMEALEON convenes stakeholders from different perspectives and generates field-based learning from different contexts, including emergency response, while Asfari deepens that knowledge through disciplined academic inquiry and situates it within broader reform conversations. This partnership enabled us to move beyond immediate response towards structured learning that informs long-term systems and strengthened community resilience. For me, this isn't just simply a collaboration, it is actually a deliberate knowledge partnership designed to advance policy impact and systematic reform.
Our findings demonstrate that local civil society constituted the primary operational backbone of the early emergency response following the September 2024 escalation. In the first 48 to 72 hours before formal coordination systems were fully activated, local organizations mobilized autonomously. Many of them were not mandated as emergency actors, yet they rapidly repurposed existing programs, leveraged trusted community networks, and even utilized internal reserves to deliver food, shelter, support, hygiene assistance, and basic health services at scale. Their response was characterized by speed, decentralization, and adaptive decision-making. Community kitchens, volunteer networks, and informal relief initiatives scaled up almost immediately, highlighting the embedded capacity of local actors to absorb shock in crisis settings. Overall, the evidence suggests that local civil society functioned not only as first responders, but as adaptive system builders, informally compensating for gaps in national preparedness frameworks. At the same time, persistent coordination vacuums and preparedness deficiencies underscore the need to transition from reactive crisis management to anticipatory governance models that formally integrate local actors into pre-crisis planning, into financing mechanisms, and role definition structures.
As the response progressed, a dual coordination structure emerged. Formal mechanisms, including cluster systems, ministry engagement, and municipal crisis cells, operated alongside informal relationship-based networks, facilitated through personal connections and digital communication platforms. While structured coordination improved standardization and documentation over time, early phases were marked by duplication, delayed data sharing, and even uneven integration of smaller local actors. Now, financing patterns further shaped response dynamics as well. Initial interventions were largely funded through internal reserves, diaspora contributions, and even community donations. Now, although some donors demonstrated flexibility through budget reprogramming, administrative constraints and abrupt funding cessations, particularly following the ceasefire, exposed structural fragilities within the funding architecture. But importantly, targeting and vulnerability assessment evolved from reactive, broad assistance to more differentiated and specialized interventions. However, under conditions of scarcity, vulnerability identification was not merely technical, it was also ethical and negotiated, and it was shaped by infrastructure constraints, safety considerations, and even incomplete information.
Today, we gathered to disseminate a research focusing on the role of civil society organizations as first and primary emergency responders in the Israeli war on Lebanon in 2024. The importance of this research is to shed light on the intervention of civil society organizations in light of quasi-absent state, but also to focus on the importance of that intervention. What is being generated from this research is important recommendations, not only for civil society, but also for governments and the donor community. The first is to adopt a national emergency response that is comprehensive, that includes all relevant stakeholders, namely civil society organizations and grassroots community-based organizations. The second is to conduct vulnerability assessments to meet the needs of those who are mostly invisible and are disproportionately affected by this crisis. It is very important for us to understand that vulnerabilities do not end when crises end. In fact, these vulnerabilities go on, and we later on learn about them. Moving forward, relying solely on civil society organizations remains unsustainable, as this is a concerted effort that requires the interventions of all relevant stakeholders, meaning donor community, public institutions, and of course civil society organizations. It is very important for us to also acknowledge that band-aid solutions are no longer applicable in Lebanon, and that it is very important for us to start adopting sustainable solutions.